Grace. I'm going to be your nurse today. Can you just verify your name and date of birth for me, please?
Tyler Jeffrey Krischka, June 26, 2000.
Okay, awesome. I just wanted to ask you some questions before we begin the exam. Today we're going to be examining your lungs, heart, and your thoracic or integumentary system. Is that fine with you?
Yes.
Okay. So, do you have a history of smoking, or have you smoked today?
Nope.
Do you have any chest pain?
You're not.
And are you experiencing any shortness of breath at all?
Nope.
Okay, sounds good. I'm just going to start by palpating these arteries up here, just one at a time. Let me know if you're experiencing any pain during the exam. Okay, good. 2+. On the other side. Good. 2+. Okay, for the rest of the exam, you can remove your shirt if you're comfortable. Alright, so first I'm just inspecting your chest, noticing any lumps, lesions. I'm noticing the skin is appropriate color. There's no scratches or anything. Sorry, my hands are a little cold. It's appropriate temperature on each side. Alright, I'm just going to palpate up here. Let me know if you feel any pain. Okay, on the other side. Okay, now I'm going to listen to your lungs. Alright, each time I place the stethoscope, just take in a deep inhale through your mouth and out. You can breathe in. Breathe. Okay. Lung sounds is good. No crackles or wheezes. I'm going to do the same thing to your back. So you're just going to breathe in through your mouth. I'm going to inspect all the same sites as I did before. Before I start, I'm going to place my hands on your lower back, and you're just going to breathe in and out. I'm just going to check for your thoracic expansion, how your back expands as you breathe in and out. Okay, so you can take a deep breath in through your mouth. And that's good. Okay. Now I'm going to listen on your back. You can breathe in. Okay. That's a regular rate and rhythm. No crackles or wheezes. Now I'm going to move on. Now I'm going to listen to your heart. First I'm going to palpate each of the sites. Let me know if you feel any pain or feel any tenderness as I'm doing so. Before, I also am noticing that your chest, the hair is evenly distributed, the color is normal for your ethnicity. I don't notice any heaves, lumps, or lesions. So I'm just going to start off at the first site. And left. Okay. Did that feel fine?
Yep.
Okay, sounds good. I'm also going to compare the side of your stomach, if you can lift up your arm, and make sure that it's even on each side. That's fine. That's fine. And then I'm going to listen to your heart with each side of the stethoscope. So I'm going to start up here. You can just breathe normally. And then I'm going to listen to the side of your side over here for 30 seconds, or a full minute. Okay. I'm just going to listen to the other side of the stethoscope. Okay. That's all good. Regular rate and rhythm. Not noticing any abnormalities. Alright, if you can lift your arms up for me, I'm just going to check your arms for symmetry, for temperature, color, any swelling, no edema present, lymphatic drainage looks good. I'm just going to have you switch over. I'm going to check for capillary refill. Oh, what's that?
Psoriasis.
Okay. Okay. Go back up in 2 seconds. Okay, good job. I'm going to listen to your radial pulse, or not listen, palpate. +2 on that one. You can see that one coming up. That's crazy. Okay, +2 on the other one. I don't know what that is. Okay.
Pulse.
Okay. I'm gonna assess your lower extremities now. Stop kicking your feet. I'm gonna check if you could lift your pants up a little bit. I'm just gonna check your legs for any swelling, edema. Seems like you have good lymphatic drainage. I'm gonna check your toes for your capillary refill. Go back up in 2 seconds. And same on the other side. I'm gonna feel your pulse, your dorsal space. Okay, it's strong. It's +2. Go on the other side. It's +2. I'm gonna feel for your posterior. Just gonna put my hands over here. Also +2. It's strong. On the other side. Okay, that's good. You can bring your pants back down now. Alright. And that looks all good with me. You can put your shirt back on. And if there's anything else you needed, any questions? Okay, your provider will be in just a little bit. Thank you. Alright, and then after I would document that his lungs were normal, ratio, and his breathing was relaxed and even. He had a normal skin tone and texture on his chest. His skin and his hair was evenly distributed. His had an even thoracic expansion bilaterally. It was the same on both sides. I didn't notice any lumps or tenderness present on the front or the back of his chest. He had normal soft, low-pitched breath sounds in the vestibular region. His heart, the carotid and arteries were +2 volume and +2 rhythm. He had no lifts, heaves, thrusts present upon inspection. He had no thrills were present or pulsations, he had no thrills. And upon palpation. His apical pulse was even and regular with +2 volume, +2 rhythm. I could only hear the S1 and S2 heart sounds present at the 5 valve sites, and they were all even and regular. He had a normal skin tone on his arms and legs. He had normal skin texture on his arms and legs. His hair was evenly distributed. He had a normal temperature along his arms and legs. His right and left arms, his legs were all symmetrical to each other. There was no edema present in the upper extremities or the lower extremities. He had no clubbing of his fingernails present. He had a capillary refill of under 3 seconds. He had in both of his fingers and toes. He had regular, even radial pulses, +2 volume and rhythm. He had no edema present in his legs. Regular, even in his posterior tibial pulse, which was +2 volume and rhythm. And he had a regular, even dorsal pedis pulse, which was +2 volume and rhythm as well. That's it.